Welcome to class, students. Today we'll be looking at a very vital topic titled Cardiac Arrest and the Chain of Survivor. Cardiac arrest and the chain of survivor. Introduction. What is cardiac arrest? Cardiac arrest is a sudden stoppage of heart function where the heart abruptly ceases to pump blood effectively throughout the blood. When the heart stop pumping blood, that is what is cardiac arrest. This critical medical emergency prevents blood flow to vital organs, particularly the brain, and leads to loss of consciousness and breathing. Unlike a heart attack, where blood flow to part of the heart is blocked, cardiac arrest involves an electrical malfunction that disrupts the heart's normal rhythm. This often causes ventricular fibrillation (VP), where the heart muscle contracts rapidly and chaotically, preventing effective pumping. Complication of cardiac arrest, as we can see in this image. Cardiac arrest, a sudden loss of heart function, can lead to various complications, some of which can be life-threatening. Here are some of the common complications associated with cardiac arrest: the resulting brain injury, neurological dysfunction, disorder of consciousness, changes in the quality of life, disturbance of consciousness, and physical and psychological well-being. Why is it dangerous? When the heart stops pumping blood, organs are deprived of oxygen, potentially causing brain damage or death within minutes if not treated immediately. Symptoms of cardiac arrest are immediate and severe. Examples are sudden collapse. For example, you're in a space and somebody collapse. No pulse, no breathing, loss of consciousness. Sometimes warning signs may appear before cardiac arrest, including the chest discomfort, shortness of breath, weakness, and heart palpitations, though it often occurs without warning. How to identify health emergencies? We have the cardiac arrest versus heart attack. In cardiac arrest, you have disruption of heart electrical signals, while the heart attack, damage to heart muscle. Cardiac arrest happens suddenly, while heart attack symptoms can build gradually. Cardiac arrest, there is no pulse, while in heart attack there is pain in chest, arm, jaw, or back. In cardiac arrest, loss of consciousness. Then in heart attack, trouble breathing, indigestion, then sweating. In cardiac arrest, we have immediate resuscitation necessary, while in heart attack can be treated medically. So there's the difference between the cardiac arrest and heart attack, because most of the time cardiac arrest is being likened to heart attack, so it is different. One is more severe than the other. So look at the cardiac arrest versus heart attack again. Cardiac arrest is an electrical problem, as we can see in the image. It is an electrical problem, while the heart attack is a circulation problem. For example, when artery is blocked, or when your artery is blocked, you can see the difference between the normal artery and the blocked artery. Or there's the cardiac arrest where it is arrhythmia, arrhythmia, okay, arrhythmia. It is arrhythmia. So cardiac arrest is an electrical problem, while heart attack is a circulation problem. So cardiac arrest versus heart attack, it occurs when the heart malfunction and stop beating unexpectedly, while heart attack occurs flow when blood flow to the heart is blocked. What happens? Second later, a person becomes unresponsive, is not breathing or is only gasping. Death occurs within the minute if the victim does not receive treatment. That is in cardiac arrest. While in heart attack, symptoms of the heart attack may be immediate and may include intense discomfort in the chest or other areas of the upper body, shortness of breath, cold sweat, and nausea of victim. More often, though, symptoms start slowly and persist for hours, days, weeks before a heart attack. Unlike with cardiac arrest, the heart usually does not stop breathing during a heart attack. The longer the person goes without treatment, the greater the damage. The heart attack symptoms in women can be different from men: shortness of breath, nausea, vomiting, and back or jaw pain. So what to do during cardiac arrest? Cardiac arrest can be reversible. It is treated within few minutes. First, call your local emergency number, that is EAD, if available. Use it as soon as possible. Okay, call your local emergency number, then you can use the EAD if available. Use it as soon as possible. If two people are available to help, one should begin CPR immediately while the other calls your local emergency number and finds an EAD. But for heart attack, what to do? Even if you are not sure it's a heart attack, call your local emergency number. Every minute matters. It is best to call your local emergency number to get to the emergency room right away. Emergency medical service, that EMS staff, can begin treatment when they arrive up to an hour sooner than if someone gets to the hospital by car. EMS staff are also trained to revive someone whose heart has stopped. Patients with chest pain who arrive by ambulance usually receive faster treatment at the hospital too. So cardiac arrest is a leading cause of death. Cardiac arrest affects thousands of people annually, with about three-quarters of them occurring in the home. So look at the electrical issue and the pumping issue. That is the difference between cardiac arrest and heart attack. Cardiac arrest is electrical issue, like a power outage, the heart stops beating. While heart attack is a plumbing issue, like a clogged pipe, blood flow is blocked to the heart. So emergency treatment, immediate intervention is crucial and includes the CPR, that is cardiopulmonary resuscitation, defibrillation using AID, that is automated external defibrillator. Then with prompt and appropriate medical care, survival is possible. Heart attack warning signs and response guidelines. Heart attack often presents with these key signals: chest pain, persistent pain, pressure or discomfort in the chest lasting more than 3 to 5 minutes or that comes and goes, may feel like pressure, squeezing, tightness, aching or heaviness. Pain characteristic often starts slowly as mild discomfort, typically start centered in the chest and becomes constant, usually not relieved by rest, position changes or medication. While discomfort in other areas may spread to shoulders, arms, neck, jaw, stomach or back. Also have breathing difficulties. Person may breathe faster than normal, having noisy breathing or experience shortness of breath. Another symptoms or additional symptoms are pale or aching skin, especially around the face, sweating, dizziness, nausea, vomiting, fatigue, light-heartedness or loss of consciousness. Gender difference in heart attack symptoms. While both men and female typically experience chest pain or discomfort, women are more likely to experience shortness of breath, nausea or vomiting, back or jaw pain, unexpected fatigue or malaise, a typical chest pain near the breastbone. Recommended response to suspected heart attack is call the local emergency number, have the person stop activity and rest comfortably. Sitting is often easier for breathing. Losing any tight or uncomfortable clothing. Monitor person close, observing any change in condition. Prepare to perform CPR and use an EAD. If the person loses consciousness and stop breathing, ask about heart disease history and assist with prescribed medication if applicable. Offer aspirin if medically appropriate and local protocols permit. So the chain of survival is to call 911, start CPR, use AID, EMS response, hospital care, and recovery. Those are the chain of survival. Recognize cardiac arrest and emergency number, that is 911. Begin your CPR like you have your 100 at the center, push hard and fast in the chest center, 100 to 120 compression per minute. Use your AED, we'll send you like MS response, that is emergency medical professionals, hospital care and recovery. That is care providers, address survivors and families' physical, social and emotional needs during hospitalization and after discharge. Thank you very much for listening.